Our lecture is Tooth Development Part 1. Dentition. We have two dentition. Primary dentition develops during a prenatal period. It contains 20 teeth. And second dentition is permanent, which develops as the jaw grows and matures, which includes 32 teeth. Period in between during the pre-teen years mixed dentition period. There are multiple stages in tooth development, but three major ones actually is the initiation stage, which begin from 6 weeks of the embryo to the 7th weeks. Bud stage would develop at 8 weeks of embryo. Cover stage would develop at from 9 to 10 weeks. Bell stage from the 11 to 12 weeks of the embryo. Appositional stage varies per tooth. Maturation stage also varies per tooth. Tooth development is the complex process by which teeth from embryonic cells grow and erupt into the mouth. Tooth morphogenesis is an advancing process that is regulated by sequential and reciprocal interaction between the epithelial and mesenchymal tissue. Tooth development. We have 3 morphological stages of tooth development. This depends on the morphology of the enamel organ of the tooth germ, which divided into 3 stages or 4 stage, depend on the bell stage. First one is the bud stage. This is the bud stage. And second, when the enamel organ is appear like cup, this is called cup stage. C, this is the early bell stage. And D, this is late bell stage, or called oppositional stage, when the dentine and the dentinogenesis develop, or crown formation in this stage. In E and F, a crown formation development. And in G, when there is the tooth eruption, or called root formation and eruption. And H, when the tooth is reached the occlusal plane and in function. Initiation of tooth development. The initiation of tooth development begins at 37 days of development with the formation of the continuous horseshoe band of thickening of epithelium. This in this slide in the upper jaw, and this is in the lower jaw. In the location of upper and lower jaw, primary epithelial band. This is called the primary epithelial band, which is initiation from the thickening in the oral epithelium in this region. Each band of epithelium will give rise to the 2 subdivisions, which is dental lamina and vestibular lamina. Dental lamina appear as the thickening of the oral epithelium adjacent to the condensation of the ectomesenchyme. This is the oral epithelium, and this is the thickening of the dental lamina, which is formed in the lingual side, or the lingual part of the primary epithelial band is the thickening toward the ectomesenchymal region in this area. Dental lamina appear as thickening of the oral epithelium adjacent to the condensation of ectomesenchyme. 20 area of enlargement or knob appears, which will form tooth buds for the 20 primary teeth. At this early stage, the tooth buds have already determined their crown morphology. Successional lamella or lamina from the which permanent tooth develop. This is the dental lamina which form the primary dentition, and also which form the permanent dentition, or permanent successor of the each deciduous tooth. Tooth development is a continuous process, however, can be divided into 3 stages depending on the morphology of the enamel organ, as we said before, into bud stage, cup stage, bell stage, which include early and advanced bell stage. Dental organ or tooth germ is a term used to constitute the structures that has enamel organ, dental papilla, and dental follicle. Enamel organ, which form the enamel, dental papilla, which form the dentine and the pulp of the tooth, and dental follicle, which is formed the cementum and periodontal ligament and alveolar process of the tooth. This diagram shows the embryo, and this is the oral cavity, and this part is cut and show the thickening of the oral epithelium and the formation of dental lamina. This is the formation of bud stage, and this is the condensation of the ectomesenchymal cells adjacent to the enamel organ in bud stage. This is the cup stage. This is the enamel organ of the cup stage, and this is the dental papilla covered by the dental sac. This is the bell stage or advanced bell stage by the formation of the dentine here in yellow. This is the enamel organ, and this is the formation of pulp when the dentine is formed. And this is the erupted tooth when complete crown formation and complete root formation. This diagram shows the oral epithelium in green color with dental lamina, which is continuous with the oral epithelium, and the brown color, which shows the ectomesenchymal tissue, and this is the formation of the dental papilla and dental sac. Why we call ectomesenchymal tissue or ectomesenchymal cells? Because the migration of neural crest cells, which come from the ectoderm during the neural tube formation from the end of the neural tube, these cells, neural crest, migrate to the second cell layer, which is called mesoderm. When these cells migrate inside this cell, this called the ectomesenchymal cells. Ecto refer to the ectoderm, and mesenchymal refer to the mesoderm. So the dental papilla and dental sac is come from the ectomesenchymal neural crest cells origin. This is histological section of the bud stage. This is the enamel organ in bud stage, and this is the dental lamina, oral epithelium, which cover all the oral cavity during embryogenesis, and this is the tongue. This is mecal cartilage, and this is developing bone. This is the ectomesenchymal condensation near the enamel organ in bud stage. This is also the high power or high magnification of the enamel organ in the bud stage. This is the peripheral cuboidal cells, single layer of cells, and this is the middle portion, which have the polygonal cells in this picture, and this is the dental lamina, and this is the oral epithelium, and this is the ectomesenchymal cells condensation toward the enamel organ in bud stage. This slide shows the formation of the cup stage, second stage of tooth development, when the shape of the enamel organ look like the cup, and this is the formation of dental papilla from the ectomesenchymal cells and the formation of dental follicle or dental sac, and this is the dental lamina, and this is the oral epithelium, and this is the oral cavity, and this is the tongue, mecal cartilage, and developing bone of the lower jaw. This slide shows the higher magnification of the cup stage. This is the enamel organ in cup stage, and this is the dental lamina, and this is the oral epithelium. The enamel organ in cup stage is composed of a 3-cell layer, which is the outer cell layer, which cover the convexity, and this is the inner enamel epithelium, and this is the stellate reticulum. The outer enamel epithelium is composed of single cuboidal cells, and the inner enamel epithelium composed from tall columnar cells, and this stellate reticulum composed of polygonal cells separated from each other by intercellular bridges. And this is the dental papilla adjacent to the inner enamel epithelium and covered by dental sac. This slide shows also the late cup stage. This is the enamel organ in cup stage, and this is the dental lamina, and this is the oral epithelium, and this the stellate reticulum in enamel organ, and this is the inner enamel epithelium, and this is the outer enamel epithelium. This is the dental papilla, and this is the dental sac. Here present the enamel node. EK represents the enamel node, which is the proliferation of the center portion of the cell of the inner enamel epithelium, which is on one of the transient structures present in late cup stage and air level stage. And why we call this structure transient? Because this appears in the end of the air level stage. The function of the enamel node is to determine the morphology of the cusp of the enamel organ. This picture also represents the late cup stage. This is the enamel organ in late cup stage. This is the dental lamina. This is the outer enamel epithelium, and this is the inner enamel epithelium, and this is stellate reticulum, dental papilla, and dental sac. This also represents the enamel node. When the enamel node is continuous proliferation toward the outer enamel epithelium, this called enamel cord. And when this enamel cord reach to the outer enamel epithelium, this is called enamel septum. All these represent the transient structures present in cup stage. Thank you for listening.